for this wonderful talk. For those of you that weren't here yesterday, Dr. Rivara was the keynote speaker for the Harry Benby lecture for the Pediatric Resident and Fellowship Competition, and gave a wonderful rounds on sport concussions and the evidence behind policy change. We're very pleased to have him the second time here, Mitch, or sorry, Krim, to talk about how to write well and how to get published in JAMA Pediatrics. Dr. Rivara is a professor and vice chair of academic affairs in the Department of Pediatrics at Seattle Children's Hospital. He holds an endowed chair at that institution and is also the editor of JAMA Pediatrics. Looking at his CV this morning, over 500 publications, which I am very impressed with. Over 30 years of injury prevention, focused largely on sport concussions, and most recently won an award for mentoring in 2012. So thank you very much, Dr. Rivara.
So, as Jonathan mentioned, I'm editor of JAMA Pediatrics, and just wanted to try to give you a little bit of the peek behind the curtain of what goes on in a journal and potentially help you to write better and get your work published. JAMA Pediatrics is actually the oldest pediatric journal in the world. It's undergone multiple name changes. It used to be, started out as the American Journal of Diseases of Children. It's owned by the AMA, and then they have a family journal, and then they became Archives of Pediatric Diagnostic Medicine, and then in 2013 it became JAMA Pediatrics, and all the journals there are changed to kind of use the name of JAMA to kind of go over that. So it's, let me start off by saying that I think writing is a learned experience, it's a learned skill. And when I started off back in the late 70s, I was the world's worst writer. I used to laugh at my work. I didn't have the icons of one English class in college, and so I really do think it's a learning skill. So a little bit of a paid political announcement here. It's part of this JAMA network, so there's 10 journals in the JAMA network. They just started a new journal, JAMA Oncology. JAMA is obviously the flagship journal of this. Impact factor, everybody looks at that, which those of you who don't know is basically the number of citations to articles in the journal divided by the number of articles published in the journal. And we're right behind Pediatrics, and this one intended to be Pediatrics, which is the journal of the American Academy of Pediatrics. And in terms of one of the reasons to publish, we have a lot of visitors to our website. So just to give you an idea of the legislative success there, I just want to give you the facts. We published 105 original investigations, 9 review articles, 47 editorials, and 28 viewpoints. So viewpoints are a feature that we started a couple of years ago, the old JAMA journal started. And it's basically a 1200-word kind of commentary editorial that are usually unsolicited. So if you have a burning issue that you want to write about and feel strongly about, it's really an opinion piece, and I really welcome those sort of things. On my mind pieces are pieces where it's really kind of more of a heartfelt expression of your experience as a physician or as a patient physician, people talking about their experiences, and we publish them from students all the way through senior faculty member. JAMA published one recently by a high school kid. Her dad is David Cornfield at Stanford, and he took her on rounds one day as a 15-year-old and saw this kid who later ended up dying, and she wrote about sort of meeting that child and experiencing that. So these are pieces for those of you who like to write pieces. The other thing I didn't put up there, which I should have put up there, is that we also have clinical problem-solving cases, so the cases of the month. So it's basically presenting a photo of a child or an image, and then using it as an unknown and then kind of a description of what the case was. So for those of you who have really eager residents that you see something really interesting on the wards, that may be an interesting thing to write up and present. And those are really, what we like really is more, not the zebras, but sort of common things presenting uncommonly. So we get about 1,100 original investigations. That's sort of the basic research papers submitted annually. And I reject 66% without review. So those are papers that I feel are likely not to ultimately get accepted. Case reports, we don't really publish case reports anymore. If they're too narrow, like I just rejected one this morning, was a paper looking at, from Japan, looking at the people getting growth hormone and how that will be influenced by financing. So if you kind of start on growth hormone and then what your insurance was determined with the likely to continue growth hormone. A very good paper, I think, but it was really too subspecialized for us. So those are the kinds of things. And I try to see, as you can see, reject within a day. So I don't want to hold people up. I feel like it's not fair to them to send something up for review that you think is never really going to get published. So I just want to fully process them. And people get a little disconcerted by that, but it's always painful to submit a paper online. You have to go through all of those boxes, and then 2 hours later you get it rejected. But you're not wasting time. And then you can see that the acceptance rate is 9%. It's dropped down. When I took over the journal 15 years ago, it was 20%. And now it's 9%. So here's sort of the usual process when you submit a manuscript. Many of you will answer this, and maybe less familiar with it. So you submit a manuscript online, and then they initially all come to me, and then I will reject without review a bunch of those. And then the ones I think might be of interest, I assign either to myself, the manager, or I have 4 associate editors. Karen Ron Karen did CHOP, Dr. Susan in Seattle, Alan Job, adolescent medicine guy at Hopkins, and Deborah Palazzi, who's an infectious disease doctor at Baylor. And so they look at the paper and then also make a decision whether they want to reject that without review or send it out to review. And then we pick reviewers. And how we pick reviewers, we do ask authors to suggest reviewers. And we actually did a study early on when I took over, and we did a randomized controlled trial comparing author-recommended reviewers to reviews that we would select. So it took one that the author recommended and one that we selected, and we compared their reviews. And we found out that the quality of the reviews was really pretty similar. The ones that the author suggested were slightly more likely to recommend acceptance, but not that significantly different. So we continue to use those reviews. Now, I think of those of you who have those opportunities in journals, use that opportunity, but use it wisely. So you don't want to recommend somebody for your institution. I automatically don't use those. I also generally don't use somebody who you publish other papers with. So I look and see, is this somebody that you publish 13 papers with? We're not going to use that person. What you really want to do is use it to recommend somebody who you think is really quite knowledgeable in the content area. And the more narrowly focused your paper is, the more important it is to, I think, use that chance to recommend reviewers, because it's really hard otherwise for me to figure out who I should send out your papers to be reviewed by. I use your references to look at potential reviewers. I also have a big database for reviews as well. So we send it out for review. We usually send out to 2 reviewers. Jem usually sends it out to 3 reviewers. The reviews come back out, and we give people about a 3-week deadline. For papers, for the most part, at least in our journal, and I think most of the really good journals, that the delay in getting back to you is usually due to the reviewers. And just, as a reviewer, if you decide, if you agree to review something, do it right away. Do it reasonably rapidly within a couple of weeks. The worst thing that happens is that somebody basically craps out, and I kind of get sort of they agree to review a paper, and then like a month later, they have a return to review, and you buck them, and then they finally say, I don't have time to review it. Well, that's, I've wasted a lot of your time. And so if you're going to review something, actually do it, and B, try to do a good job of it. That's the other problem, is you come back and you get a review that's really kind of lousy, and then have to get another review or so. And reviews come back, and if paper looks like it might be a reasonable paper, we then have a statistical editor who we send it to, and that person, Ben French, he's at UPenn, and he will take a look at it as well, make comments. And then once every other week, we all get on a conference call, where we have associate editors and myself, and we discuss the papers. So the person who managed it presents the papers, talks about the review, and then we talk about it. And we'll talk a lot today about what goes into that decision to publish something on. But just to say at this point that we certainly use the reviews, but it's not, our decision is not based solely on what the reviewers say. And so we commonly get letters about, well, why'd you reject my paper? The reviews are really good. That may be true, but as you all know, those of you who do reviews, you also have some confidential comments to the editor, which as what you don't see. So the reviewer might say some things about, and the confidential comments to me about why they don't think the paper should be accepted. Very commonly, we have a reviewer that says, accept with one revision, and the other reviewer says reject, so we have to kind of figure out what to do. And then we make a decision. We either accept the paper with revisions, revise and resubmit, or reject. So in my career, I think I've had one paper accepted without revisions. So, you're going to have to revise your paper. That's really pretty typical. It's probably it's probably not a good journal if you have a paper accepted without revisions. Every paper you make those. Revise and resubmit. If you get that, you're probably 85% to the goal. All right. So if those revise and resubmit, we usually will accept about 85% of those. Even at JAMA, we accept a lot of those. And then you get we have a rejection. People ask me a lot about whether or not you can ask for a re-review. And yeah, I think you can. Sometimes we'll grant that, sometimes not. Like I have a paper in my queue today that was one that I rejected, then senior author wrote me and wrote a letter about why she didn't think that was a right decision. So I said, okay, we'll go ahead and revise it. On the other hand, I had a former resident that I rejected the paper with that review, and she wrote me back like a two-liner sort of saying, why'd you reject my paper? I think it's really important. And then I wrote back and said, oh, I didn't think so. And then she wrote me back and says, well, I think you're wrong. And I know her, it's sort of, yeah, so I didn't give her a review. The other one was really nice and explained why she thought I was wrong. I gave her a review. And then you want to revise your paper and send a letter back, responding to the comments. We'll talk a little more about that. And then it comes back to us, the managing editor will look at it. Some journals will resend it out for a review. We do that very rarely because I think it's basically the editor's job at that point to get all this information and make a decision rather than send it out for a re-review and have the reviewers make that decision for you. I think that also the journals that do that are going to add on there 4 to 6 weeks in terms of the waiting for a decision. And then we'll go through, we'll at that point accept it or reject it, or there might be some minor tweaks. So that's sort of the typical process of pretty much every journal. So you all, I think, pretty much know this, but I want to just briefly go through it. So there's the introduction, the methods, the results, and discussion. Introduction is why did you do the study? Methods, how did you do the study? Results, what did you find? And discussion, what does it mean? Okay. And by the way, I had Sybil's, I sent Sybil all these slides, and so you can get those through Sybil. So first of all, let's talk about the title. In general, we don't like declarative titles, but we don't like titles that say, this drug improves the outcome of people with X disease. We really like this would say, this is a randomized controlled trial of X drug and this disease. If you have a randomized control trial, make sure that's included in the title. If not, we'll make sure you include it in the title, because randomized control trials are very important. If you have a meta-analysis or systematic review, include that in the title. Don't make it cutesy. I had a paper that we accepted on pediatric nephrolithiasis, and he had some cutesy kind of introductory phrase to that, and I maybe take that out. Don't make it too long either. We sometimes joke among ourselves about titles being 3 sentences long. So here's some titles in the literature. That's a declarative. That's a declarative title, so it plays an important role rather than sort of saying what's the association of SES to cancer outcome. And again, this is another declarative title, as we're all in these. And this one here is probably good, but it's pretty long. So you have to figure out how you can chop some words out of that. Okay? But titles clearly are important, and you need to spend a little bit of time sort of thinking about it. But again, don't try to be cutesy with it. So the abstract. Now the abstract is really important, and we all go on PubMed, and yesterday that most of the time we go to Google or something else, but we go to PubMed, and most of us only read the abstract. So the abstract is really important. If you want your article to be, the whole article to be read, you need to make sure that you have a really good abstract. And it takes some time and effort to make a good abstract. The abstracts are usually all structured. All journals pretty much nowadays will have a structured format for your abstract. They also need to be concise. PubMed has 10,000 characters as the limit on an abstract. If you go beyond that, then it gets cut off. You want to, in the abstract, keep all abbreviations to a minimum. It makes it difficult to really read the abstract, and it's distracting in many ways. Well, if you want actually some data in the results section of the abstract, you want to actually show the results. And some journals actually don't want numbers in the abstract. I think that's silly. We really want data in the abstract. Your conclusions should follow from the data and not be a leap from something else. So you might sort of say that, Jonathan might do an intervention trial on physical exercise in kids that has a particular kind of intervention. And then he shouldn't say that this program should be done across the country, because that doesn't necessarily follow, and it might be an efficacy study rather than the effectiveness trial. So you have to make sure that it really follows what you said. The major theme of the paper, the introduction. So this is still the abstract. So what you want to do in your paper is really have what are the 2 or 3 takeaway points. If I was to get you in an elevator, what are the 2 or 3 points that we want to try to convey? These need to be emphasized in the results section, the abstract, and the conclusion should depend upon those. And this is really what you should be highlighting in the results section in many tables. So here's some data-less abstracts to give you some examples. First one here, compare children with different behavioral protocols. They said that kids who exhibit a compromised ability to self-regulate at highest BMI. Well, it doesn't really tell us what really is the size of that effect. Is it a large effect or is it a small effect? So we have to kind of depend upon you or to go ahead and read the whole paper to really understand what's the effect size there. Here's obviously a kind of a long, complicated results section of an abstract that, you come away and you feel like, well, there's something here, but what exactly is the effect size is really important. So you want to really have the abstract to be more concise, more pointed, and to have some results in it. Here's another core abstract. The purpose is probably okay. There's a couple of things that miss. What do you think is missing from this abstract? take a quick look at it, but I think it's missing here.
You don't know what the main outcome measure is?
I don't know that. What else?
How many kids they looked at?
Right, you don't know how many kids you looked at. Was this, I said all the births at Grenoble Hospital between these years, but we don't know whether that's 1,000 or it's 10,000. Right? You know, it'd be nice to have a report about there's some data in there, but don't really have an effect size, you don't have a relative risk, you don't have the confidence intervals around, so you don't know like how precise that estimate is. So it's not bad, but it also is, it could be more improved.
Sorry. In the previous two, they had their analyses.
Right, so you have the methods, big swallowing analysis, which really should be probably the method section rather than put in the results section.
Or is that something we should be putting? That's something that I don't know.
I think so. I think, you should have under the methods, you should have design, you should have a data analysis section, and then you have in the method section of the abstract. Particularly if it's a sort of more complicated kind of a analysis, or like use propensity score matching or something like that. So I think that should be in the abstract. Yeah, introduction. It's really why you should do this. Right? It's not a graduate student dissertation laying out all the literature you've ever looked at. It really should be brief and save the rest of the discussion or throw out the rest of it. So you really want to say is, what's the rationale for the study? Show that there's an important question that exists and why prior work has not adequately addressed it. Now, when you criticize prior work, you got to be careful, right? Because first of all, that might be one of your reviewers. But you also, every study can be improved, but you also have to be careful about really criticizing someone else's work. I think that the most important thing here is being brief. So here's an abstract from a sort of social science journal. It's ridiculously long. And one of the things is to know your journal. So if you sent this in to our journal and say this is way too long, this may be very appropriate for a social science journal where they really like to have 2 or 3-page introductions where they have a review of the literature. That's just their style. But it's not the style of most medical journals. Here's probably the flip side of this. This is an article that Peter Cummings and I published in JAMA a number of years ago. This is the whole introduction. And you can see we have 3 references in the introduction. So conciseness, there's a lot of virtues in that. You don't have to have a terribly long thing. But if we had sent this to a social science journal, a psychology journal, they would have laughed and rejected it, or just on the basis of the introduction. So you have to know your journal and be careful, but conciseness is really a big virtue. Please also interrupt me as we go along, yeah.
For introduction, are you looking for hypothesis, that is, state the hypothesis?
I think so. I think that stating a research question preferably with a hypothesis is the right way to do it. So here at least we want to estimate the association between being killed and whether or not the person next to you is restrained. So I think having a good question, preferably with a hypothesis, is a good thing to do. Would that be the final sentence of your introduction?
So, rule of thumb for how long that intro should be?
I usually sort of say like 1 to 1.5 type pages, double space. So really pretty short.
And the last question, we use a consort statement for guiding our description of an RCT, but do you rely on the Strobe statement for observational studies?
We haven't to date. We probably will start doing that soon. Now, I think that the Strobe and the consort things, they're really very important guidelines, but they can make an article a lot longer.
Yeah.
So we have a word limit of 3,000 words. Which if you look at the New England Journal, they have a word limit of 2,700 words. So again, you really want to try to be concise. And the reason is that we still have, two reasons. One is that we still have a print journal. And so, the pages that we have in the journal is really pretty tight. And secondly is that you as a reader don't want to read something real long. Reading an article that's 5,000 words is really kind of like a real task versus reading an article that's 2,500 or 3,000 words. And although we don't have a brief section in order to, a section for brief reports on the journal, there's nothing to say that though we have a word limit of 3,000 words, you can't submit a 1,500 word article. Okay. So smaller is better. Any other questions? Please interrupt me as we go along. All right, so the next section is the method section. And this is really obviously pretty important. You probably want to use subheadings to help organize it to the reader. And you've got to, have the key information there, the design, how many subjects you had, how they were selected, excluded, what the differences, definitions of cases and controls, that kind of study. I think one of the things here is that, it says repeatedly, is that make sure the numbers add up. So, we all revise our paper multiple times, and as we do that, we may forget to revise another part of the paper as the numbers change. And so, a common problem is that the numbers in one part of the paper don't match up to the numbers in the other part of the paper. So you really need to be careful about that. IRB approval or equivalent is really important. You need to sort of say that your IRB either decided it was exempt or was approved. You don't need to have information without patient consent in that. Is that if the IRB is approved, that we don't feel like we're not going to second guess what the IRB did. We do have that information. Trial registration. Want to talk about that?
I was just thinking about that.
So, all journals now require randomized controlled trials to be registered. And the reason for this was, it really was because of pharmaceutical company misconduct, that the pharmaceutical companies would conduct randomized controlled trials and then never report the negative results. And so you didn't really know if you were doing a systematic review. There's this whole literature that you didn't have access to because pharmaceutical companies never reported it. And so there's this international committee of medical journal editors that decided a number of years ago that all randomized trials need to be registered ahead of time. We use the clinical, I use the clinicaltrials.gov. It doesn't really matter which one you use. There's a lot of things that you can use, but it really does need to be registered. And in that registration, you put in your primary outcomes, your secondary outcomes, the study design, the estimated sample size, and then kind of the start dates of the study. We look at that, and you want to have your trial registered before you recruit patients. It's a little bit of a painful process, so take a day to kind of get it done, but you still nevertheless need to do it. And journals, this International Committee of Medical Journal Editors recommends to us as editors that we should never accept a trial that hasn't been registered. We're a little lenient on that. We can go back and we can have people go back and do it post hoc, but that's probably going to be the exception rather than the rule. And so nowadays, if you do a clinical trial, it's not just a pharmaceutical trial, it's any other randomized trial. You need to register. Yeah.
CTs that you can register. There are definitely papers, journals that will require you register even if it's not an RCT. And then also for systematic reviews, there's registration now, so because it's easy to get started on a systematic review and then some journals are requiring that as well.
Any other question of registration? And then you can also put more detail on the web. So again, because of our 3,000 word limit, you have really extensive method sections. And so we're very commonly asking people to put a lot of more detail on the web. So you may have a really good intervention, and if you want to, rather than describing the intervention mention in great detail, you can have the intervention on the web. Most randomized controlled trials now require that they also submit a protocol to us as well. So what we're really trying to do is to get at what you say in your paper are the primary outcomes. For those are primary outcomes that were registered to have, and you described in your protocol.
One question, how do you feel about, most of us are publishing our methods now in other journals. How do you feel about saying, go see this other publication for that?
I think that's fine. I think that they still should be briefly summarized in this paper, but I think that that's fine. And, you know, one of the questions is if you publish 2 or 3 articles on a study already, and then publishing another article on that same data set, you only have to very briefly summarize the results in the method section, and what's referenced in the papers. So here's kind of a quickie way of thinking about it in terms of results. The text should tell the story, the tables give the evidence, and the figures show the highlights. So in the results, it's nice it has sort of parallel construction here that you have certain, you lay out the methods and the results kind of follow in that same pattern. I think the big thing is that you shouldn't have new unanticipated results. In the results section, you have to describe the methods for in the methods section. You also want to make sure all the results are in the results section, and you don't have like results in some of the discussion section you haven't talked about in the results section. And if you have a lot of complex data and it's a complicated study, certainly using subheadings for the results section and orders. So the discussion section here, it doesn't have to be really terribly complicated, and it doesn't have to be terribly long. So the first paragraph should be the statement of principal finding, summarize for the reader what the principal findings you had of the study. Then in the next paragraph talks about the limitations, the strengths and weaknesses of the study. In the third paragraph, put this in relationship to other studies. Why are your results similar to other studies? Why are they different than other studies? And then the fourth paragraph really talk about what's the meaning of the study. What are the mechanisms and possible implications for the study? And then, you know, this is pretty common to put in. I think you have to go on easy about it to sort of recommend future research. Yeah, it's a good study. It should be one that leads you to do more research in the area, but I think be careful about that. And I think be careful about this. So one of the best papers I've read was a paper published in Pediatrics called Drowning in a Sea of Advice. And this guy went through the different American Academy of Pediatric policy statements. And it comes out like, you know, there's 109 things that practicing pediatrician should do in every well child visit. Well, of course, that's crazy. So, you know, to add to that list of saying, well, therefore, pediatricians should do this, well, that's probably never going to happen, and it's wasted. Or, you know, or the other thing that's really common is people sort of state the obvious, you know, that, example, obesity is a big problem, and so, you know, the study looks at obesity, and therefore, you know, the study concludes we need to do something with obese kids. You know? It's really a duh. So you really need to kind of be thoughtful about what you're recommending there. The other thing is to make sure that your recommendations follow from your data. So if you studied something, say an intervention trial that just looks at a particular population in a particular kind of intervention, you can't leap from that to a different kind of an intervention. Okay? Or that maybe your results are maybe just as an observational study, you found this, but then to sort of say, we should have this intervention for everybody, and you didn't study the intervention, you just really studied the problem. Again, it's really leaping from your data to something that you really didn't study. And I think it's really important to go easy on these last two. And, you know, here's the Watson and Crick, the paper that started the whole genomics revolution. This is their kind of final sentence. You know, it's the epitome of understatement. So you really want to be careful about where you stay and not overstay your fund. So what do you do about tables? I think you have to use tables and figures very wisely. We actually have a limit of 5 total tables plus figures. And you can't label a table 2A, 2B, 2C. Now, I can count. So it's 3 tables, not 1 table. You have to use them wisely, and you have to make sure that they're not so complex that you as a reader can't really understand what's going on with it. The tables should help the reader understand the data, not be so complex that the reader really scratches their head. If the, oops, I'm touching that. If you can easily summarize the information, then you don't need a table to summarize the information in the text. So there might be, we see small tables that might have 2 or 3 odds ratios in them. Well, that probably is better in a sentence in the text rather than having a separate table for it. Now, make sure the columns and rows add up. More senior people know about that. The junior people, it's a really important lesson. And what I do when I'm looking at a table in an article, I will commonly just add up a few of the rows and columns and see do they add up or not, or is there something that's really wrong here. And then sort of stand back and look at it. Is there some figure in here that just is wrong? Most likely it's a transcription of a typo. So you really want to just sort of stand back and look at your tables to make sure that they're the right one, that they're correct. Make sure you use the right version. Again, your article undergoes revision. You may sort of reanalyze your data, and then you forget your final submission to include the right version of the tables. And then think about what you can put in an online appendix. You might have sort of secondary analyses, sensitivity analyses, things like that. That's really could very easily and appropriately be put in an online appendix rather than the main body of the paper. So here's some guides that we use in the GEM network journals, no more than 5 data displays. All of them should be cited in the text, so you don't want to have a figure that you never refer to in the text. We already said that everything should be recorded. And make sure your tables are as concise as they can be. So an article this week where somebody, and this happens all the time, where somebody had relative risk, confidence intervals, and then p-values. But you don't need to call them p-values, because the confidence intervals are actually more informative than the p-values, as you all know. So that's a column that you could eliminate. If you have a table describing sort of, say, characteristics by gender, well, you have to really put down both percent from males and females. Most of us can add and multiply, so you can figure out, you just have one gender, you can figure out what it is. I think this is important, is that they should be self-explanatory. So if you look at a table or look at a figure apart from the article, you should be able to reasonably figure out what it says. You should have titles and legends and those that are descriptive of the brief. Okay? And you don't want to have a huge number of footnotes for a table or figure, but they should be able to stand alone. And so you really need to work hard in trying to have tables and figures, I think, be self-explanatory. The figures should be used to illustrate the most important features. They shouldn't be unnecessary. Like our statistical editor thinks we should never have bar figures. That really is kind of a waste of space and could be put to a table or just something else in the text. I think you need to be kind of figures or photos watch for patient identifiers. So, if you have a photo of a child putting the flat line across the face, that's not enough to maintain the confidentiality of the subject. And we pretty much in those would require that you get patient parent permission. Or if you do get case, we have again those clinical case examples. where you have a picture of the child described their whole course, you need patient for that. We've also had those for our On My Mind, those narrative and prose pieces. If a patient, an experienced patient is really described in detail that if their mother was reading it, they can say, well, that's my son. You need to get parent permission for that. Your primary outcome data should not be presented at figures alone. I think that a lot of people make that error of just showing figures and not having any tables. They're really not going to be as useful as having information in tables. Realize that most journals would actually recreate the figures themselves. They're not going to use the ones that we do. Pie charts and 3D graphs, while they might look nice for a slide presentation, are probably not that worthwhile in a article. And pie charts, anything in particular, that could be better summarized in a text or in a table. 3Ds look nice, but most journals really don't use those. Axes have to have tables, and people actually get to put those in. Bar graphs, we already talked about, they probably should get rid of those. The stack bar graphs are, I think, really pretty hard to understand, and probably ought to be put in different format. For a survival bar, make sure you have the number that you're following at each time point along the x-axis there. We talked about photos and videos here. References, yeah.
Do you have any advice for like colors versus patterns versus things when you're trying to?
I do colors. We all have color graphs in our journals, and we don't charge extra for that. And I think that what shows up more clearly both online as well as so references. Again, your paper is not a graduate student dissertation, so you don't have to put in a huge number of references. We actually, for our research articles, limit people to 40 references. And I think that the fewer the better. First of all, you don't want to use really old references, except if it's really a classic reference on a subject. You want to have references in general that are no more than 5 years old. And you don't need to have like 6 references to support a statement that one might do. So you really want to try to use your references really carefully. Again, it's not a grant application, it's not a graduate student dissertation. And make sure you cite the evidence accurately. This is, again, obviously you want accuracy in your paper, but it can come around to hurt you, because if we select a reviewer who's the author of that reference and they read the paper and say, well, this person misquoted me, that's going to certainly harm you. So for the younger people in the crowd here, the beauty of computers is you can revise very easily. So you just want to write and just get it down on paper. People do it in different ways. I usually suggest doing the tables first, creating the tables after you've done your data analysis, and then using that to help write your results. Authorship is important, and you shouldn't list people as co-authors unless A, that they know that they're listed in, but B, that they've really met the requirements to be an author. And for those of you, again, graduate students and young faculty, this whole issue of kind of gift authorship or the senior person in the lab having the name on every paper, that's really not appropriate. You really should have followed the guidelines for authorship, which are that contribute substantially to the work, and that you can really defend the work. So that's one other thing about you include your lab tech on the study. If your lab tech or your research assistant really couldn't defend the study, the whole study, but then it's really not appropriate to include them on the work as a co-author. And you you should really instead just acknowledge on the section of paper. So going through now some reasons about why manuscripts get rejected, and we'll go through each of these in turn here. So manuscripts get rejected because it's not what's good research, and what's good research. I don't need to tell you that it's really a focus question with hypotheses that we tested. It has a well-implemented protocol, reasonably sophisticated but accurate data analysis, and no fatal flaws. So we really look for the fatal flaws in papers. As a reviewer, that's what you should look for. Is this a study that really needs to be a randomized controlled trial? It's not a randomized controlled trial, and therefore has such biases that we really can't tell whether or not their conclusions make any sense. Is it generalizable? Now, the problem of pilot studies, this is, I think, a really important problem. You know, we all need to have data from pilots to get big grants. You know, NIH now, if you have an R01, you can't get an R01 funded unless you've got two pilot data. The problem is if you have a study that publishes the pilot data, just say it's half your sample, your study's ongoing. And when you finish your study and you find exactly the same conclusions as the previous pilot data, you're going to undermine your ability to get that larger study published. Because why should I publish that larger study if it's going to say exactly the same thing that your pilot study said? I think it's a difficult problem, and I'm not sure what quite the answer to it is, but I think I'd be really careful about rushing to get something into print just because you feel like you want to get some out there in your studies, like a 3-year study, or a year and a half into it, that's an interesting result. That can be problematic when you publish the longer study. Rigorous designs, again, you can use the most rigorous design that you have. So, as I said, we don't publish case reports. We actually don't publish a lot of surveys anymore. We used to publish a lot of surveys, but the acceptance rate now is just 8 or 9%. Don't really publish a lot of surveys. I think that they're important. I've certainly done plenty of surveys in my career, but you have to realize that a lot of journals are not going to do surveys. Cohort studies. I think if you have a cohort study, the longer the follow-up, better that is. And, we get these wonderful studies from particularly Scandinavia where they follow people for 20 years and have great follow-up, 95% follow-up over a 20-year period. Those are wonderful studies that are always going to be very instructive. On the other hand, you have a cohort study, you just follow somebody up for 6 months and you have a 30% dropout rate. That's going to be problematic. So the same thing there is with a cohort study where you're going to have a 6-month, 12-month, 24-month follow-up. You have to sort of figure out when you want to publish those data, because if you publish the 6-month and 12-month papers, the 24-month paper shows exactly the same thing, you may not be able to get them published in a good journal. So, important research. Yesterday, we had the resident fellow competition. I was impressed by the fact that most of the stuff we heard yesterday was really important research. And I think, to me, it's really sad when I see a paper, I know it's from a junior faculty or fellow, and it's really not an important research question. I think that's a real failure of mentorship, that mentor didn't help them figure out, was this really an important topic or not? You don't want sort of a trainee or a faculty member spending a lot of time on something that, you kind of go and say, it's not really important research. Or, we get a ton of papers on obesity, and this is such a big problem, and somebody sends us in a randomized controlled trial, and it's negative. Well, we publish negative randomized controlled trials, but if the intervention study was something that never had a chance, you'd sort of say, of course it's not going to work. The intervention is just not strong enough that we see an effect from that. I'm not going to publish that study because it really doesn't inform the field at all. If you have a really important study that is a big intervention that doesn't work, that's fine, because that'll inform the field. But if you have an intervention that people would say, you know, wouldn't expect that to work, it's not going to be published.
Speaking to that, I sit on the RCT review committee for the CIHR, and it's amazing how often we get huge RCTs in, and the first question we always ask is there actually equipoise? Like, is there actually a question here that people disagree with is working? And it's amazing how often people are, well, of course this is going to work. You guys have been doing it already, and now you're just doing it as an RCT to continue funding. It's really interesting how often there is the lack of equipoise being tested.
Yeah, so, yeah, those kinds of things, as you always say, it's not going to get funded by CIHR, it's not going to get funded by NIH. It's an unfunded study, and people do it. You're going to have trouble getting it published. The study is timely, you know, and the data are timely, I think that's important. We will have a limit of usually about 5 years or so for a study. So if you have a study that the data were generated 10 years ago, you're going to have trouble getting that published. So if you do have studies, don't sit on the data for a long period of time. And it may not be the best use of your trainee's time to say, oh, we have some data that I collected 10 years ago, why don't you go and analyze it with a new question? Well, it may not be particularly relevant. Does it add new knowledge that potentially changes policy or practice? And the design such that it makes that new knowledge more important, i.e. is it a randomized controlled trial, a rigorously done observational study like a case control study, that it really can add new knowledge. And it's an interest not only to the reader but to the lay public. Kind of jokingly sort of say, if it only semi-jokingly say, is this likely to make the New York Times or CNN? You know, if it makes those, then it's probably going to be of big interest. And there is some data to show that studies that, these journal editor studies that are widely quoted in the lay press are actually going to be cited by authors in the work as well.
Yeah, sorry, one question on that. So an article came out in Nature this week showing the ability to replicate findings in psychological research has been difficult. So they took 100 studies, tried to replicate, only 39 were able to do that. I find if you have a result that refutes another major paper, and I see that happen, it gets harder to publish. So if you're trying to replicate a finding, or if you have a negative finding, it gets harder to get into a major journal to say, you know what, I don't know if I believe what they published.
Yeah, I think that's true. Again, you have to ask yourself, why are you doing that study if someone's already shown something? Was with some major flaws in the other study that you feel like it really was not a true answer? Or was the other study really just a small pilot? So, as an example, like I said, a lot of my research is on traumatic brain injury. And one of my buddies, Dr. Kellerman, had published a study looking at early treatment with people with traumatic brain injury with progesterone. It seems like there's some animal studies that suggest progesterone might help to reverse some of the effects of traumatic brain injury. So he published a randomized control trial that showed that it actually seemed to be effective. It was a small study. But then there was a recent study this last year in the New England Journal of Medicine, a very large randomized control trial that showed it was not. So, I think if you have a small pilot study, it may be replicated in a large study to get rid of the treatment. Brevity. And I think this is clearly important. So the Watson and Crick paper, one page in Nature. Never go back to Nature, just Google it, and you see that it's a one-page report. It's sort of astounding. It really is. And then here's one of my favorites. These were both at Gettysburg. So Lincoln gave a 268-word speech. We said the guy got up there and droned on for 13,000 words. Which one do we remember? All journals have word limits. So, I commonly get papers in, and the author says, I know you have a word limit of 3,000 words, and I couldn't cut down my 5,000-word article to less than to 3,000 words. Sorry, but here it is. Well, I say sorry, but here's a rejection. It's just, you're not gonna, you've gotta use a scalpel and cut your article back in. I think it's particularly a problem for people who do qualitative research. They aren't gonna own all those books and stuff. You don't really publish a lot of qualitative research, so that might not be an appropriate journal for us. But B, you still have to figure out how to cut down to those smaller words. When I first began writing, we always taught you use the passive voice in your writing. This was done, this was found, rather than we did this, we found that. So we really like to use the active voice. Look at the use of abbreviations. We've all read papers where it's just chock full of abbreviations, and it's hard to figure out what's going on. You have to keep on referring back to the beginning of the article to figure out what the abbreviations mean. So really be careful about doing that. And then cut out your adjectives and adverbs. What is a massive problem to you might not be considered by me as a massive problem, or dramatic change or drastic change. Those words, those adjectives and adverbs don't really belong in the scientific industry. Here's the Watson paper. That's it. All right, data analysis. It sort of showed you early on that introduction, which was a psychology or social sciences journal. So I have more of a background in epidemiology, and epidemiologists have a certain way of doing the data analysis, which is really quite different than people in psychology. Doesn't mean one is better than the other, one is wrong and the other is right. It's really, different journals have different styles, and different disciplines have different styles. So you need to really pay attention to the journal that you're publishing your work in. I'm sure you're all fairly sophisticated and realize that p-values are not all that helpful. It's better to have point estimates and confidence intervals around the point estimates. Pay attention to and deal with missing data. So it came up yesterday, one of the residents talks about this talks, is that it's clearly been shown that omitting cases or missing data leads to more biases than some multiple imputation. Okay? So really pay attention to missing data and not just ignore it. And we all know biostatisticians have a real role in our research. When presenting statistics, follow the guidelines of the journal. That's probably the most important thing. And then present all the results, not just those that are significant. So you don't want to cheat. And again, this gets back to trial registration. What's the primary outcome? You present the primary outcome. And then if there are secondary outcomes, really say that they're secondary outcomes. If something's exploratory, sort of say that it's exploratory. But you really need to limit the number of sub-analyses that you do. Most studies are not really designed to look at different sub-analyses or subgroup analyses. Oftentimes you have the power to look at different subgroup analyses. So I think really be careful about that. Choosing a journal. It should be really pretty easy to choose a journal nowadays because everything's online. And so you can go online and look at prospective journal that you might be thinking about, and to read those articles and sort of say, is this good fit for my journal or not? Is it the kind of manuscript that the journal publishes? So this issue of like, should you shoot high and then get shot down and then submit to a lesser journal? I think it's got to be a balance there. The New England Journal has an impact factor of 54, and probably an acceptance rate of a couple of %. So, it's going to be really tough to get you picked up in the New England Journal of Medicine. You have to think about, is this really worth your time and effort and get rejection from the 10 minutes later. On the other hand, if you feel like you have a good article, it might be worthwhile to go ahead and submit to a top-tier journal. One of the things that's nice about the JAMA network is that if you think you really have a terrific paper, you could send it to JAMA, and if it gets reviewed there but rejected, you can have it then sent to us, and we'll get their reviews, and we can go ahead and make a decision based upon their reviews. I won't really resend this out for a review. And all the network journals are like that. So that's an example. That's a really advantage of something like JAMA, the JAMA network. So really carefully think about what you're doing. I think having a little loyalty helps, in the sense that, if I know you and you've published in the journal before, I might give you a little bit of slack on your subsequent emissions there, submissions. So, I think having some loyalty to your journal is probably good. And then there's also this website, I don't know if any of you have ever heard of it, but you can go to this website and then paste in your abstract, and then you can select them, and it can give you the journals that publish that kind of work. It's a really kind of good website. Things that annoy, you spelling my name. This week, this is the second thing here. So it was a president, and he sent me a paper. It's one of those piece of my mind kind of articles, but it was addressed to the New England Journal editor, and it sort of talked about a section in the New England Journal. So obviously he had sent this thing to the New England Journal and got rejected, and he forgot to basically change the cover letter and send me the cover letter to the New England Journal editor. He was a resident, so I wrote him and said, "Did you realize you sent me the cover letter to the New England Journal?" That was embarrassing. But that happens, and it doesn't endear yourself to the editor. If you do that. Again, something that's too long, I'm going to send it back, either reject it out of hand or say, I'm interested in your paper, but you got to cut it back. So, we have word limits for reasons, we'll respect that. Numerous typos. I kind of view it as sort of a cumulative hit kind of thing. So, if you have a paper that has a bunch of typos and then you have a table that maybe there's, the columns and rows don't add up, I sort of view that as this is a person that's sloppy and can't really trust their science, and I'm going to reject the paper because of that. The spin and boasting, again, not using a lot of adjectives and adverbs. I'll make you take those out if we go to the point of wanting to accept your paper. So save yourself a lot of time and not put those in there. So this is not revising the paper after it's been rejected by one journal. Realize that we may not be the first journal that people send their work to. And so they send us to it after it's been rejected by another paper, another journal. It happens like at least a couple of times a month where we'll get a reviewer that writes back and said, I reviewed this article for another journal, and I rejected it from that journal. They didn't follow any of my comments. So what do you think I'm going to do? Reject it again. On the other hand, if they say that I rejected this journal and made a lot of suggestions, and they really have changed it and improved the paper, well, then I'll go ahead and take a look at that paper. And the more narrowly focused your paper is, the more likely it is to get a reviewer that's seen it before. So you really always want to take advantage of if somebody's, if you submit your paper to a journal, and somebody's taken the time to review it, and those have been rejected, to go ahead and try to revise it, use their comments to make the paper better. It happens really all the time. Using the format of the prior journal submission, and I know that it's just second time around, third time around. So the reference styles or something else, make sure that you revise it to fit our style. Believe it or not, we actually have a reason for printing the instructions. That people actually read it. I realize that most people don't. Editing your paper, clearly going through multiple drafts. So, like how many drafts do you tell your trainees to go through on paper? Several. Probably at least 10. That paper that I showed you with Peter Cummings and I did with that really short introduction to the seatbelts, that went through 22 revisions before it was finally accepted. So, you have to sort of give your trainees that the second or third revision is not close yet. You got to revise it a lot of times. Looking for internal editors, we already talked about that. And then here's, what happens to your manuscript. Accept the revision, but that revision, again, is really rare. Accept the revision. It's still a contingent acceptance. So if you don't revise it according to the comments, I, as an editor, can say, well, you didn't do what you were asked to do, I'm not going to accept it. So it's very rare that would happen. But realize that you do still have to revise your paper. Again, this revise and resubmit, if you get that, you're probably 85% of the way there. So why do we reject something without review? Long term, it just maybe we have a more general medical journal, maybe too specific. Data are too old to be relevant, they mentioned that. It's not new or novel. You know, we publish about, as I showed you, 110 papers a year, so I can't take stuff that's really not novel. I'm going to really get stuff that's going to be new information and legitimate information. Poorly written abstract would be something that would really lead me to not accept the paper. Poorly designed or wrong analysis. Sweeping conclusions, I think that's really the most common problem that I see, is the conclusions surely don't follow the data. You don't publish case reports. Editor having a bad day, Howard Department put it in, I don't know if I can do that. Now, we mentioned this peer review of things. And again, the more specialized your topic is, the more you should take advantage of the ability to choose reviewers for your paper. So as a reviewer, what do the reviewers assess, and what do I want to get out of the reviewers? Really kind of depend on the reviewers for two things. One is the content experts. So is this really an important question in the field? Is this something that has not yet been asked and answered? Does this make a contribution in the field? And the second thing is in terms of the methods, is this really a rigorously done paper, or are there problems with how it's done? Are there any fatal flaws in it or not? Remember that as a reviewer, you were really just making a recommendation to the editor. And as a reviewer, it's really important to be careful when you write a review that not to put comments that go to the authors that in some way tie the hands of the editor. So to really sort of say, like, you know, this is a terrific paper that definitely should be published. To put that into comments to the authors may make the author feel good. But then if I end up rejecting the paper, they really create a bind for me. You're certainly welcome to put all that stuff, and want you to put all that stuff into the comments to the editors, but really to be careful about what you put into the comments to the authors. I don't edit the reviewers' comments. I don't feel like that's fair, so I will just send the reviewers' comments to the authors unedited. So that's why I think it's really important to be careful what you're writing those. I think, obviously, be reasonably polite. Say this is the worst paper I've ever read on the subject. You know, if it's somebody who is from another country and English is not their first language, you don't need to point that out to them or to me. It's pretty obvious. And just to realize that the opinions of the reviewers are not mine. There are a lot of things we take into account. How important we think this is, how much room do we have. I try to keep a low inventory so that when papers are accepted, they can be published relatively rapidly. So we really look at each month, how many papers have we accepted this month or not. You know, if we've accepted a slew of them already, and you're at the end of the month, unfortunately, you may not get accepted because you've already accepted a lot of papers. Sort of mentioned this, is that we review the paper, and then pretty much all the papers that we end up publishing, we're going to get statistical evaluation on. So, you know, in terms of responding to reviewers' comments, my recommendation is you review the reviewers' comments, read the reviewers' comments, and then put it away, walk away, and go back to it another day. You want to really address all the reviewers' comments, and I like to see, if I do it with my own papers, and usually we'll paste the reviewers' comments into the response letter and then a different font with my response now. But I like to see both of those, and as an editor, it makes it a lot easier for me to see what the reviewers' comments were and then the response, and I sort of have two things open on the computer to look at what the reviewers actually say. You know, it's important not to sort of say, we've written referee that, and then sort of say, I'm not going to change it and give the reason why. That's fine for something, but you can't do that for every comment that the reviewer makes. Right? You got to, throw me someplace. and to make some changes. Be polite. Hopefully the reviewer is polite to you. Be polite in your responses back to the reviewer. If you disagree with it, it's important to explain why you disagree with it, not just give some reasons why you disagree with something. Other issues off the ship. We mentioned this before. I think that here's the ICMJE requirements for off the ship, and you really don't want gift offers. You don't want to put someone in paper just because they need a paper for their CV so they can get promoted, or that your head of your lab or your department chair expects it. I think it's a big problem in surgery. I don't know. The surgeons oftentimes are the chair of the department. Is that your experience too?
It used to be before, you don't see that.
Don't see it anymore. Yeah.
But it definitely has been something we've seen in the past.
Yeah. Again, I think that, your lab tech or your research assistant probably can't meet these requirements. So you probably need to. Just to mention it, I trust that you're not doing any of this, but it is problems that we sort of see. Fabrication is making something up with a whole cloth. The falsification is sort of manipulating the data in such a way that it's really not accurate, it's not true. Ethics, I tell my trainees is to always assume that the ethics committee needs to review a study. Now, things have loosened up a little bit in the United States now, in that if you use a database that's public use and it's anonymous, they consider that the exempt, and you have to submit that to the ethics committee. But it's nevertheless good to put that down in your article to say this is exempt by our IRB because it's public use without any identifiers. Big issue is this last bullet here. What's QI versus what's research? And hospitals do QI all the time, and they don't have to get IRB permission to do that. But then if you want to publish the results of that QI study, what do? And I think IRB is really vary tremendously on that. It's that an issue here in this country.
So I've met with them because I do global health projects, and they do review things that might not necessarily need review in order to allow someone to get into a certain journal, or because it's a requirement, even if they don't really feel there's an ethical concern to be reviewed. So they're pretty good here about that.
I think it's all issue of IRB of QI projects. One is a research, but it's a QI and it can't be published. I think it's still a movement towards it. Plagiarism. This is a problem. Unfortunately, it only happened to our journal a couple of times. I had one instance, unfortunately, this was picked up by a reviewer reviewing it. This guy basically plagiarized his own work, the reviewers would. And then I had another instance where the reviewers have the sense awfully familiar with another study I just read, and kind of looks at it and it's actually plagiarized. And, that gets you in real hot water if you know that. But you have to be real careful in terms of even how much do you paraphrase, how much do you put into quotes. So I think it's lessons that we all try to teach all the trainees to. Now, duplicate publication. This is something that may be a little bit more difficult to try to figure out where to draw the line. So this duplicate publication where it's really the same data published twice. And I had one instance of this where an article was picked up by somebody after the publication. Somebody in my department was picked up after, he picked it up after the paper was published and said, Fred, I really read an article that looked very similar to this in the European Respiratory Journal. And so I went to that paper and looked at it, and then looked at what we had printed in our paper, and the tables were almost identical. And so contacted the editor of this other journal, and he didn't know really know anything about it. And then contacted the author, and, she explained that she thought it was a different audience, and it was okay to publish with European audience versus American audience. Well, that's really not appropriate. So, we sent the information into the National Library of Medicine, and, PubMed now is labeled as a duplicate publication. PubMed will label it as such. So you really have to be careful.
So you can't retract it then? You can't then add it to the side?
We could retract it. We didn't, because it wasn't, we felt like it wasn't false, it was just that it was duplicate publication. Carol?
I've seen papers where they've taken, like, exactly, like, this is our primary outcome, and that's them, and then secondary outcomes are different papers. And
So that's a salami slicing.
Yeah.
So, it's an issue of how thin do you slice the salami?
Right.
How much do you cut up your data into separate publications? So, I've had instances where people send me the results of a study on boys and then send me another publication on girls. And, you get a paper that says boys, and they say, well, do you have girls in your study? And they say, yes, but we're going to put them in a separate publication. No, you got to combine the two. And they said, well, I couldn't fit it into Word. Well, I'll give you an extra 500 words and put it in the same page. So I think there are, big data sets where there are different questions, and they legitimately deserve to be in different publications. But I do think you have to be careful about how thin you slice the salami. And I think that if you have any question, you need to have the editor be the one that makes the decision about, is this duplicate? Should this be one publication or not? And we actually, read our author guidelines, is that if you have a prior publication on something that is similar, you're supposed to send me that publication as well, even if it's in press or under consideration at a journal. So it's really me that decides whether or not this is duplicate publication or not, what the outline is. So I think it's an issue that we all deal with, and I just would urge you to be careful about how thin to slice this along here. Honorary authors, no, they don't really meet the ICU and JE requirements, and they really shouldn't be given, even if it's your boss. Ghost authors, can be a problem. Here's this person into the study post for 2 years ago at BMJ. You can see that ghost authorship is not really uncommon. Okay? So you need to make sure that the people who are part of the work are named as authors, can defend the study. People that are not part of the work should not be authors. And I think it's also important to tell your faculty to distinguish between being an author and a collaborator. So you might have a big group that publishes a paper, and what it might say is 5 authors for this group. And instead of the group, then, listed in PubMed as collaborators, the authors are those listed as collaborators, not as authors. You have to make sure people understand the difference. We counted that recently in somebody's CV or promotions. Conflicts of interest. We all deal with this all the time, and it's perceived conflicts of interest. Everybody has conflicts of interest, but you have to sort of figure out is how you manage those conflicts of interest. So if there's any question you want to declare, okay, I think that's really the issue. Is you want to declare any conflicts of interest. We don't publish a lot of drug randomized trials, but if you look at sort of the psych journal, the infectious disease journals, those authors there do a lot of industry studies, and their authors are in their list of conflicts of interest. They'll list like speaker bureaus or have done work for 10 different pharmaceutical companies. So, and that's okay. You just need to declare that. Spin and boasting. We published a little paper on this in a journal a few years ago. And here's some the examples of spin and boasting. Reach alarming proportions, drastic increase. Boasting, opening up new frontiers. How many times you wrote, this is the first study, or the largest study, or the best study, that's kind of boasting. So we really need to be careful about that and try to edit those words out of your articles and your training articles. Common mistakes, rushing the abstract at the end and making sure people don't make sure that it fits the data well, poorly referenced, spelling errors, data that doesn't match up. And then this bait and switch again is why we want to see trials registered. Keys to success, clarity, brevity, novelty, some modesty, and looking up the truth. And I think the final slide here is, I really learned that writing is a learned skill. As I said earlier, that I was a terrible writer when I first started, and I really do feel like you can get better at this point. Try to do state-of-the-art research with the leading edge. I like to collaborate with others. I think that you end up, most of the work we do now is team science, and it's more fun to do better research. For my fellows and mentees, I say, don't write something you can't publish. They might be asked to do something, write something, and my criteria for them is this something that you can eventually publish or not. If it isn't, it probably isn't worth your effort and time. And then finally, there's nearly always a journal out there that will publish your work. You really should have very few papers in your file drawer that never get published. And I think in many ways, particularly if you're involved with patients and your studies involved with patients, as part of your ethical contract with them is that you're going to publish the work. You're not going to never write that work and publish. And I think finally, rejection doesn't mean it's a poor paper. It just means that it's not a good fit for the journal. So, thank you. Any other questions here? Yes.
What happens when a reviewer writes an honest review, but with a tone that is less than polite?
Again, we don't edit that. I think you have to try not to take it personally.
Well, that's the challenge for the researcher, but I'm thinking from the editor's
From an
perspective.
editor, I will, we grade reviewers.
Oh.
So we grade reviewers, excellent, very good, fair report. And I may not use that review ever again. And I generally will not use reviewers again that I grade as even good. I will use those again. I really want to be excellent, very good. And the reason is that trying to be fair to the authors, that if you get a lousy review, then have to make this decision. Make a decision based upon one good review and one lousy review. Do I have the author wait another 3 or 4 weeks to get another review? So it really is unfair to the author. So I try to really make sure that they get good reviews. Not always successful doing that, but I certainly try. Yes.
That was a great talk. Thank you very much. We've had one question as a writer and one question as a reviewer. We've had 2 papers where it's been revised and resubmitted. And in both cases, we made the suggestions. And it was as if the reviewer didn't even see our response to reviewers. So in one case, it was a randomized controlled trial. They said, repeat the analyses and do it this way. And we said, okay, guys, we'll do that. And then it came back and he said, I can't believe you guys did that. Oh, right, reject. And it was in one of your competitor journals, right? And
Was it sent out for re-review?
it was sent out for re-review back to that same person. The other reviewer said, ready to go.
Yeah.
And I would hesitated sending it back to the editor and saying, this is.
Well, I think that, in that case, you might just call up the editor and say, I need guidance.
Okay.
I've done that, call up the editor when you get, conflicting reviewers and just sort of say, what do you really want me to do here? Or do you really want me to do this reanalysis and change the paper in this way? And the editor usually kind of should be able to give you some guidance. And I think it's perfectly fine to call up or email directly to the editor and say, I'm confused, give me some guidance here, but what do you want me to do?
And then as a reviewer, I often get the slices the salami issue where, you have a cohort of 200 people or a randomized controlled trial where you have the exploratory outcome measures now being analyzed, and P.04, and they're saying, this is an important finding, you're saying, this is a third publication out of this trial.
Yeah.
I don't think you're powered to see this, and I'm not the statistical expert, but I would outright reject it just to say.
Yeah, and I think that that's appropriate. I mean, I think that, and we had this discussion the other day at the general board about what do we do with people looking at these secondary analyses, secondary outcomes, and some people say we should not do that at all. They say, well, yeah, this is what we're doing. So I think that, it gets down to the whole, one thing, that the power issue. Was the study designed to look at differences by gender and differences by race? It wasn't, enough power, you really shouldn't be doing those analyses because they're just. Yes?
You talked a little bit about recommending or suggesting reviewers for your people, but some journals, I'm not sure about yours, if give you a chance to say people you don't want to review.
We did that.
And is that a good thing to do?
Yeah, I mean, I think that, I honor those. I think that you shouldn't do it lightly, but if you really feel like there's somebody that hasn't, you're in a field that's, where somebody else has a really totally different opinion from you, and you don't really agree with the person at all, and realize that this person reviewed your paper, he or she would give it a lousy review because they disagree. I think that's perfectly legitimate. I think that, the other instance would be is if you're in a very competitive field and you don't want to basically show your intellectual property to this person just yet, then I think that that's also an appropriate thing to do. And we'll honor those. Any questions? So, again, thank you.
I had one
Go ahead.
So as a reviewer, so I've received a few reviews where I go, it's a one sentence, I think this is good, yeah, publish it. Or as a reviewer, I see the second reviewer has said that, and I've listened to my things to change, and so just whether, did I go overboard on saying things to change?
No, I mean, I think that then that's, I would rate that as a poor review or basically did return review, one sentence review like that. So that's really not important. The author, the editor, again, was probably faced with the choice, like, what do I do? Do I make a decision based upon one good review, one poor review, or do I send it out for a third review and make everybody wait? So and that's why if you're going to do it, if you're going to agree to do a review, try to do it